Hello students, today we are going to discuss post-operative care, means the care to be taken after surgical procedure. Learning objective of today's lectures are to know basics of post-operative care, to know complications occurring in post-operative period and management of such complications. By the end of this lecture, you will come to know actual clinical application, how post-op care is to be taken in any after surgical procedure. Good afternoon, dear students and colleagues. Myself, Dr. Sumedh Vasnik, working as a professor, PG and PhD guide, head of the Department of Surgery, Prora Medical Trusts, Ayurved Medical College, Shawgaon, District Ahmednagar, Maharashtra. Today's topic is post-operative care. Success or failure of any surgical procedure operation is totally depend on three parts: pre-operative measures, things or measures to be taken before any operation; second, actual operative procedure; third, post-operative care. These three phases or parts are equally important. You cannot skip or give less importance to one of the part. Three parts has got its own importance. Today we will focus on post-operative care. Learning objective of this particular lectures is to know basic idea, fundamentals about post-operative care. By the end of this lecture, you will come to know basic of the post-operative care, complications which can occur in post-operative period and management of the same. Under post-operative care, we will discuss wound care, shifting of patient to the recovery room, shifting of the patient from recovery room to surgical ward, position of the patient in the bed, charts to be maintained, nil by mouth, IV fluids to be given, drugs to be administered, early mobilization of the patient, diet to be given or advice to the patient, rounds to be taken by surgical team, medical team and paramedical staff, also nursing staff, discharge of the patient from hospital, and lastly follow-ups of the patient. First of all, let us discuss wound care. Wound care, after surgical procedure is over, last stitch is applied to operative wound care starts. First of all, you will have to clean the wound and operative field with antiseptic solutions like Savlon, betadine, spirit. Then dressing is applied. In certain cases, bandages are to be applied. If the wound is big, if there is big cavity, you can put drain to drain secretions. If there is collection of secretions, there can be chances of post-operative infections. So in supramajor surgical procedure, major surgeries, and in abscess with big cavity, you can put the drain. Regular inspection of the wound till patient is discharged. Daily or all alternate day you will have to inspect the wound. If needed, if there are signs of infection, wound contamination, you will have to explore the wound meanwhile, and suture removal by the end of week if the wound is healthy. Recovery room care. After operation is over, patient is shifted from actual operative room to recovery room, means post-operative room, where all all vital functions are monitored by junior doctor or postgraduate trainee. Care should be taken till patient is out of anesthesia, and if patient is relatively okay, he should be shifted to surgical ward. In some cases, in minor cases, daycare cases, patient is discharged till evening, so patient is admitted on daycare basis. But major surgical procedure, patient has to stay in the hospital for a week or more than a week. Patient can be given general room, special room, and in supramajor cases or major cases with comorbidity, ICU. There is medical staff who, who is looking after to the patient, UG students, interns, PG students, junior doctors, consultants, even nursing staff, attendant, helper. So round they all these peoples, they are round the clock on duty to take care of patient. Surgical ward or surgical rooms, special rooms should be well equipped with instrument and equipments. After shifting patient to the surgical ward, position of the patient is given according to surgical procedures done. Because patient is under anesthesia, patient may be sedated, so you will have to carry and shift patient gently to surgical ward. There are certain charts to be maintained 4 hourly, 6 hourly, 8 hourly, or 12 hourly, like temperature, pulse, respiration, blood pressure, input output chart, in case of abdominal surgery, abdominal girth, measurements of the wound, NBM, kneel by mouth. If the procedure is done under local anesthesia, patient can have liquid or solid diet after 1 hour. If patient is given sedation with local anesthesia, patient should be given liquid diet after 4 to 6 hours. If the procedure is done under spinal anesthesia, patient should be given liquid diet initially after 8 hours or till intestinal sounds appear. If the procedure is done under general anesthesia, patient should be given liquid diet to start with liquid diet after 6 to 8 hours or till intestinal sounds appear. So in general, for minor cases, 4 to 8 hours NBM is sufficient. Major cases, 8 hours to 72 hours or as per need. As patient is kept NBM, patient is not given anything by mouth prior to surgery and during surgery. To maintain hydration, to maintain electrolyte balance, patient is given IV fluids, that is parenteral nutrition. In certain cases, in some cases, blood substitutes, we may have to give blood substitutes if there is loss. Crystal colloid solutions, lactose solutions are also given in post-operative care. The averagely 3 to 4 liters fluid should be given per day to the patient. So for first few hours, glucose is needed, so dextrose solutions should be given preferably. In post-operative period, various drugs are to be given to patient like antibiotics to prevent infection, anti-inflammatory, to reduce inflammation of operative site, analgesic means painkiller, antipyretic if patient runs fever, antiemetic to prevent nausea vomiting, S2 blocker to prevent hyperacidity, and certain supportive drugs as per need. Then mobilization. Early mobilization is always needed. Initially on the bed, later on the ground. Mobilization should be slow and gentle. It prevents deep vein thrombosis. It enhances wound healing. It enhances circulation at operative site also. So early mobilization is always advised to patient in post-operative period. Now diet. After breaking NBM, initially soft liquid diet like sips of water should be given to patient. Then if there is no nausea vomiting, if patient can accept and digest liquid diet, you can shift patient on semi-solid. Lastly, regular diet should be given as per patient's recovery. Diet should be non-spicy, it should be balanced, it should be protein rich, it should contain vitamins and minerals. Diet is always helpful for speedy recovery of the patient and better wound healing. Then rounds. In post-operative care, in post-operative period, patient is admitted near about for a week in the hospital. So round the clock care has to be taken by medical and paramedical staff, nursing staff. Usually rounds are taken to watch vitals of the patient, vital functions of the patient, and wound healing, and to observe post-operative complication if any. Rounds should be taken by students, intern, then residents means PG student, and consultant also. In case of emergency, everyone should be called. A head of the department and higher faculty should visit surprisingly to the ward. In rounds, clinical notes should be put down on patient's file. If everything is okay, patient can be discharged. In daycare minor procedure, patient is discharged on the same day. For minor procedures, next day. For major procedure, patient is discharged after a week. For major procedure, patient should be admitted for 2 weeks at least and then discharged if everything is alright. While discharging, discharge card should be given to the patient. It should one has to mention everything regarding operative procedure on discharge card, which is duly signed by medical officer, residents, consultants, and HODs. While discharging, general instructions should be given to the patient regarding diet, regarding exercise, regarding movements. After discharge, regular follow-up patient should be called for follow-up to monitor clinical conditions of the patient, to see any complication. Initially, follow-ups are on short duration, then weekly, then fortnightly, then monthly. If required, you can call patient after 6 monthly, even 1 year. This is in short all about post-operative care for undergraduate medical students. Thank you.